guys, good afternoon to all of you. Thank you for joining us today live from Island Hospital. My name is Belloni Lee. I'm the audiologist in Island Hospital. Well, thank you for the opportunity today for me to share with all of you that who is an audiologist and what do we do. Well, audiologist is actually a qualified hearing health professional who identify, diagnose, and manage individuals with peripheral or central hearing loss, and tinnitus, and also balance disorder. In short, we deal with your ear and your hearings. So then will come the next question. Are you an ENT doctor? Well, no, we are not ENT doctors, but we work closely with each others. And besides that, we work together with speech and language pathologists and pediatricians, psychologists, and sometimes oncologists for those patients who have hearing loss after their chemotherapy. Well, so this is a human ear where we actually deal with it every day. So mainly our ears can be classified into three parts. First would be the outer ear here when you pull your son or daughter's ear. The outer ear here includes the canal. Middle ear includes your eardrums. And also our inner ear includes the cochlea and also the nerves. Well, hearing problems also can be classified into three. So if you have a conductive hearing loss, meaning that you will have problems at your outer ear and your middle ear. And if you have sensory neural hearing loss, meaning that you will have problems in your inner ear. And if you have mixed hearing loss, meaning you have a mixture of both. Well, our ear is actually a very magnificent organ and they help to detect, transmit and transduce the sound from outside into our brain. And also it helps to maintain our sense of balance. So our ear is actually helping to collect sound from outside, but the one that do the hearing is actually the brain. That is why we need both ears to help to collect all of the sound from our surroundings so that our brain can get a full picture and help to make sense of all of the sounds. Well, now every day we deal with your ears and hearing. We will do hearing screening for infants, for newborns, and preschool child. And also we do hearing assessment, hearing tests, and then we will give intervention, which is the hearing aids and cochlear implants to those who need. And here are some numbers from WHO that I wanted to highlight to all of you. First, there is over 5% of world population, which is 466 million people who is having disabling hearing loss, and that includes 34 million children. And from that, 30% of childhood hearing loss is due to preventable causes. So, which means we can actually prevent that. Well, 1.1 billion young people are actually at risk of hearing loss due to exposure to noise. And last and the most important thing is that it's only 17% of those who need hearing aids are actually using one today. So meaning that there is around 83% and there is a lot of people out there are still neglecting their hearing loss. And sadly, a lot of them are saying that I am not deaf yet, I no need help, and that is so wrong because the impact of hearing loss is much more serious than you can think of. So please, I would like to urge your urgency to bring yourself or your family members who has hearing loss to see an audiologist today. Right, now let's talk about your ears and hearing loss. So the causes of hearing loss, there are a lot. But here we would actually bring out some common causes. Yeah, mainly the first one would be age. Aging is a common cause, as what we know. And then it will be like loud noise exposure, diseases, lifestyle, medication intake, and even genetics. So if you have parents or grandparents having hearing loss, beware and do your hearing test, your hearing routine checkup, yeah, every year. And actually, the hearing loss can be prevented if we are aware, right? So try to avoid loud noises, especially when you are working in a noisy environment, let's say in a factory, or if you are working in the airports. You must be using an earplugs or an earmuff to protect your ear. Besides, take care when you are listening to music. Yeah, try to stop in between, meaning that remember the 60-60 rules in is you cannot exceed 60 minutes every time you listen to your headphones on earphones for musics and cannot over 60% of volume. So it's below 60 minutes and below 60% of volume. Besides, get your hearing tested once you feel that there is something wrong with your hearing or your family members' hearing. Well, when hearing loss attacks or when adults have hearing loss, yeah, there will be an impact. Means that if you have hearing loss, the first thing that will be affected is your communication ability to communicate. So you will hear sounds, but then you will hear a lot of sounds not so clear, and sometimes you will misunderstand people, and that will sometimes affect your job performance, right? And imagine a elderly who is having hearing loss, sitting around at the corner of the living room, looking at the family members, and but then they are not joining them because of hearing loss, and that will cause them to feel lonely and isolate themselves, and sometimes frustration and stress, right? Falls in elderly is not common, but a lot of us doesn't know that the falls might because they have hearing loss. Well, in US, they have already detected that a lot of incidents of fall happen because the elderly have hearing loss. Therefore, the hearing aids that they actually created can have the ability to tell the person that tell other people that they have fall in there, right? Besides, hearing loss always comes together with tinnitus. So if you have tinnitus problem, which is the ringing sound in the ear all the time, yeah, it might also cause a disturbance in your sleeps. So all and all, it will actually reduce your life quality. And besides, I would also like to draw your attention into the effect of hearing loss and dementia. Because according to research, hearing loss has been detected as a risk factor to dementia. As for children, besides the reduce in the speech perception, they will of course will cause a speech delay in them, and then that will cause a reduce in your academic performances, and thus it will draw into isolation, depression, and also lower in self-esteem. So when you detect any delay in your child's speech and language development, do not wait to seek for treatment or help from pediatrician or audiologist. Do not fall into the trap that people saying, my son, your son 2 years old never talk is very normal. My friends can only talk at 3 years old. It's very normal. No need to see a doctor. That is so wrong. Okay. So all in all, early detection and intervention is very, very important when it comes to hearing problems. So this is a audiogram where we usually plot your hearing threshold on it, and you can see the sounds are actually scattered at all different places, which means that they are at different frequencies here and they are at different loudness. So it is not about that you can hear and you cannot hear. It is that how much you can hear and how clear you can hear. So when you initially have an hearing loss, a lot of people would not aware because hearing loss always comes in at high frequencies part here first. So our brain is so intelligent that they couldn't detect the loss because they adapt to the loss. And for you, you just feel that, I can still hear sound. It's just that sometimes people's speech is not that clear. For example, when people say strawberry, you hear it as lorry. To you, it is not wrong, it is lorry, but the exact words is actually strawberry. So that is the time where when people complained you about listening wrongly and interpreting wrongly, right? And that is also the time that most of the time where the tinnitus kicks in, right? So if you come to us and seek for intervention, which is using a hearing aids, the results will be very good because the effect is only at the higher frequencies. But if you wait for longer in time, the deterioration will happen and your hearing will drop also at the mid and the low frequency parts. At that time, you will hear everything softer and even the TV sounds mumbling, and even in quiet places also you will feel difficult to understand people. At that time, you will need more time to get back to your hearing even after you put on hearing aids. This is the severity of hearing loss. So if your threshold is here, meaning that you will have normal hearing. But the lower it goes, yeah, you will meaning that you have the more hearing loss. So the more profound hearing loss you have, the more time needed and the more effort you need to actually get adapted and get the optimized results and get the benefits from hearing aids. So meaning early intervention, better results. And then people will say, okay, I know I need a hearing aids. So now can I have only one side instead of two? Well, if you have hearing loss in both of your ears, you should put on both sides. Imagine if you have only one side of hearing aids on one side, then you will still lose 50% of the sound information from the other side, meaning the sound that goes into your brain is still not maximized. And then you will came to us and say, hearing it's not helping and all that. But in fact, it's because the stimulation that you have given is not full. And it's not enough for the brain to get to maximize the hearing. Right? And if you put on both sides of hearing aids, it will actually helps you to localize sound better, yeah, and also to understand speech even in noisy environments. And also you will experience a more complete and comfortable sound. Imagine a headphones that you put on only one side and both sides. So that is the difference. So now people would say, how could I see you? How can I see you, right? How can I reach to you? Well, thanks to Island Hospital, we are actually a multidisciplinary hospital. You can find every specialist here. So if you have hearing problems, any of it, please see the ENT doctors, right? And then after they rule out the outer ear and middle ear problems, it will come to us that we will help you to choose the suitable intervention. For instance, hearing aids. So we will help you in selecting few hearing aids that is they might be suitable for you according to your hearing level. Then after that, you can have a trial on those hearing aids, and from there you can choose which hearing aids is more suitable for you and you feel the most comfortable. And that we will fit you with the hearing aids. And congratulations, that is just the beginning, right? Your hearing aids journey is just started. Your hearing aids won't give you the 100% comfortable sound. You don't feel like it's perfect at the first day because we all know that our brain needs time to get adapted back to the hearing that they get back. So at the beginning of the hearing aids fitted, we couldn't give you a full 100% of amplification. You might feel it too loud, not comfortable, and you don't want to wear it. So at the beginning, we will give a level that you feel comfortable with, and still you can hear everything a bit clearer and louder. Then you have to use it every day. So after some time, say 1 month later, you might feel that how come my hearing aids is not that clear anymore, not that loud anymore. And to us, that is actually a good sign, which means that you have already adapted to the sound is given. So that is a time where we can actually increase the amplification. So don't worry if you have any problem with hearing aids, you can always come back to us and we can actually fine tune the hearing aids according to your preference from time to time. Well, then people would say, I don't want to put on hearing aids because it is so ugly, it is so bulky. But in fact, you can see here, hearing aids nowadays has become so small and the design is much more beautiful and stylish. As you can see, even the biggest hearing aids here is actually much more smaller than last time's hearing aids. And thanks to the technology, nowadays hearing aids also comes with a more powerful but smaller in size, and the sound is also much more clearer, and a lot of people can also started to accept hearing aids. And as you can see here, some of it is actually quite invisible, right? Then you would ask, when should I see an audiologist, or how should I know without doing hearing tests that I might need a hearing aids? So I will show you some points here. If you score more than 1, then you might need to see us. If you score, the more you score, then you better faster to see us, right? So first, do people seem to be mumbling or talking in a softer voice than usual? Do you often need to turn up the volume on the TV or radio? Do you find it difficult hearing the doorbell or the telephone ringing? When you are in a group or in a crowded restaurant, is it difficult for you to follow the conversation? And is having a phone conversation difficult? Do you sometimes miss keywords in a sentence or frequently need to ask people to repeat themselves? Do you find it easier to understand a man's voice compared to a woman's or child voice? Do you find it difficult to pinpoint where is the object from the sound it makes? And lastly, do you have tinnitus? Well, ask yourself or your family members all these questions. If they scored more than 1, 2, 3, or even 9, please come to see us as soon as possible. Right? Yep, so that is all of my sharing. Now let's look into the question and answer part. If you have any questions, you can also type down here. So if I see, I can answer to you right away. Now, let's see, the first question is, how can I improve my hearing? Well, basically, your hearing cannot be improved. It can only be preserved because the hair cells in our cochlea, when it gets damaged, there is no medication can actually restore them or regrow them, right? So please take care of your hearing because it only can be preserved. It cannot be improved. Next, what should I do if I get sudden hearing loss? Well, if you get sudden hearing loss, see your ENT doctor as soon as possible. Do not wait, right? Because we see some cases where sudden hearing loss can be treated and the hearing can be improved using medication. How do I know if my father have hearing loss? He can sometimes hear me and sometimes he can't. Well, just bring your father for a hearing test and we would know that from the threshold and the hearing test that we did. And then you would know that whether he has hearing loss or he just he just don't want to listen to you, right? So are there any health downsides to not treating hearing loss? Well, as what we mentioned just now, yes. And the main concern for us now is dementia, the relation between dementia and hearing loss. What are the signs of hearing loss in children? Well, the first sign is that they will like ignoring you when you call them. They are like not listening to you, not responding to sound, and not looking for sound, and also speech delay, of course. Will my hearing loss get worse, stay the same, or can my hearing be restored? Well, it really depends on what types of hearing loss that you have. If you have like conductive hearing loss or mixed hearing loss, yes, it can be helped or it can be restored once maybe the wax or the infection goes away. But if it's the sensory neural hearing loss, yep, as what we mentioned just now, it cannot be restored. But it can only be helped by using hearing aids to amplify the sound from outside, and we restore the hearing in the brain, not in the ear. So will hearing aids or a cochlear implant help me hear better? Of course, because hearing aids and cochlear implants are made to help you. But of course, if you come in earlier, there is always solution for you. So don't wait until there is too late, right? Next, I often use a cotton bud to clean my ears after shower. How deep should the cotton bud enter my ear before I cause any injuries to my ear? Well, regarding cotton bud, we often hear questions from almost all of the people, can I use cotton bud? So our advice is you do not need to use a cotton bud to clean your ears. So if you are talking about the wetness in your ear after the shower, yes, you can use a towel and you just wipe the outside of your ears without going into the canal, right? I love blasting music when I listen to songs via earphones. Will this cause hearing loss in the future? Yes, I would say in long term it will slowly affect your hearing and it might cause hearing loss in the future. So remember the 60-60 rules, yeah? And also, if possible, you can choose headphones over earphones and you choose speaker over headphones, right? Another question is my child is 4 years old and she is having some difficulties in speech. What should I do? Well, if she has difficulty in speech, see an speech and language pathologist and they will be good to help her. But before that, you can also bring her for hearing tests. If she has hearing loss, then we have to give intervention. And if her hearing is perfectly all right, then you just left her for the speech and language pathologist to deal with her, right? And that is it. That is all my sharing for today. Remember, it is always more than just hearing, and there is always solution if you comes in early. So if you have any problems related with your ear and your hearing, we are all here in Island Hospital. We are more than happy to help you. So thank you very much for tuning in today. We will see you next Wednesday for next session. And remember to like, comment, and share. See you again. Bye bye.